My name is Dr. Kimberly Brown. I'm a naturopathic doctor in San Jose, California. Tonight we are going to talk about hair loss in perimenopause and menopause. Oh, by the way, I am live from my garden and there's a helicopter going overhead, so we might be interrupted a few times, maybe from my dog too, who might wander by. Now, she is not suffering from any hair loss. She is a golden retriever mix, tons of hair. Anyway, hair loss is a problem for most women in perimenopause. If you Google it, it will say something like, oh, maybe 2 out of every 5 women, half of all women. It's most women in perimenopause. And oddly enough, we don't know exactly why it happens. Is it the fluctuation of hormones? Is it the fluctuation of hormones and its effect on cortisol? Is it androgens? It might be androgens. And the fact is, androgens are male sex hormones, and they do tend to rise in perimenopause and menopause. But it's not always a problem for women in menopause. I've seen that with prescribing testosterone. I don't see hair loss. So it really depends on what your body's doing, and I think that's why we don't know why exactly it happens. So you're probably wondering what you can do about it. Well, that's a complicated answer. There are things we can do to prevent the hair loss. I wish I could say we were always successful, but again, it's a mystery as to why it's happening. Now, early in perimenopause, if you're having heavy, irregular, frequent periods, then we can look at iron, and that can be an easy fix. Now, do not take iron unless a doctor has told you to take iron, because it can actually be harmful if you don't need it. But then, is it estrogen? I had a patient early on, perimenopausal, and we tried estrogen. It was her idea. Let's try estrogen. I'm having periods, but I'm having low estrogen symptoms. Yes, you are. It didn't help. I've prescribed testosterone to most women. Doesn't cause hair loss, and then in a few it does. I've tried herbs that this can work in perimenopausal women. Women, when we do test their androgens, they're high or they're on the higher end of normal, then we can do herbal formulas to help prevent that conversion. I saw a patient today, started seeing her about 10 years ago in perimenopause, and her major complaint was hair loss. Hormones and nutritional support and herbs have helped. Unfortunately, she does continue to have some hair loss in menopause, but when you look at her, you wouldn't know it. There are those hair, skin, nails formulas, other companies that do collagen, may or may not work. Always, ask your doctor. We can work together, getting different formulas. I often tell patients, if you haven't seen any change within 3 months, it's likely not going to help. And that's because, the hair follicle, it takes about 3 months to see any growth. So maybe go on to 4 months, but then we need to just try something else. And then, of course, there's medications. Not something I do, but something that if we've tried everything and we just can't solve the problem, then I will refer for them to talk to their doctor about medications, which can help, but also those don't always help. So hair loss in women in perimenopause, and even for the guys, gosh, please, medical researchers, help us out. But again, I do help a lot of patients with hair loss. It's just one of those things that can be challenging in perimenopause. So everybody, thank you. I can see a few people there that I know. Thank you for joining. These are fun to do, and I'm going to get back to my garden. It's time for fall cleanup. Everybody take care. Bye.